but I know what you said because I had eyes on what was going on here, and I really appreciate you being here. And Senator Sheen, the combination of your leadership for small business, being governor and knowing what small businesses face, being governor and knowing what everyday families face, it's really shocking what's going on here in Washington, and you know that. But it's truly shocking to me that we're actually having a public policy debate about whether we cut health care as opposed to improve health care. And the theory of the case for folks who are in favor of this $1 trillion cut in Medicaid and now expiration of the credits that have been a lifeline, I read about your business, Mr. Baker, has at its core a premise that if you don't have health care, you won't get sick. So health care reform is taking health care access away, and voila, no problem. But we know that's not the case. In this $1 trillion in cuts in Medicaid, you know, $150 billion out of the hospitals. It's not just $150 billion out of the hospitals, because all those folks who used to have Medicaid are going to still get sick and show up at our community hospitals and get treated, and our hospitals will provide that care as long as they can, but there'll come a point where they're bankrupt. I mean, that's literally what we're talking about. So your hearing here is focusing on these affordable care subsidies. And the other thing I want to say, this is not a situation where it's an optional benefit or an optional good that a person or a family can decide they want or don't want. If somebody in your family gets sick, you got to get care. You'll do whatever it takes, pay whatever you have. You'll get a second mortgage. You'll go into your retirement funds. You'll do whatever it is to take care of that person in your family, your child, your partner. So there's a cruelty to this policy as well as a total blindness. So, you know, Mr. Baker, I saw the incredible interesting thing that your old company went from onto the Affordable Care Act, right? Yeah, just describe that. I mean, you probably did, Jim, but I think this is really a hardworking company, a successful business. A lot of people depend on these jobs. And what I've heard from employers, and I know you have too, Senator Shaheen, is that at the end of the year when you get hammered with that premium increase, you have this difficult conversation with your employees who are like family to you. And it's about, do you want us to pay the premium increase or but we can't give you as big a raise as we'd like to, or, you know, there's that trade-off. So maybe you could describe that a little bit. Well,
as I said earlier, and thank you for the questions, Senator Welch, and I do know the difference between Vermont and New Hampshire.
Stop there, okay? She does enough bragging enough as it is about New Hampshire.
I did summer in Newbury. I really do know the difference. We played whack-a-mole with insurance costs. You know, we've switched from provider to provider to provider for years, trying to manage the input costs of health care, not only for the business where we contribute half to our staff, but also for our staff. We need healthy staff. We don't want them to take time off to be ill. We're a small organization. We want to encourage their healthy life everywhere we can. It's good for us. It's good for them. It's a virtuous circle. The latest rate last year came in from Blue Cross Blue Shield at an increase of 34%.
It's unreal.
Largest one I've seen in close to 40 years. It was a real shocker. And we're a small organization. We're flat. We have talked about health care person to person for 25 years at least. And so I gather the staff and say, hey guys, what are we going to do about this? I don't have any control over this. Let's talk it out and choose a course. Obviously the staff was stunned, and there was some trepidation about switching to the ACA. There's a lot of unknowns. No one had really considered it. It was a bit complex for me to work through some of it, but you know, it's a complex situation. It's a complex offering. And the staff decided that, okay, we're going to accept the company not offering health care. We're going to accept that the company's going to pay us, and then we're going to go find health care. And my office manager, God bless her, walked my staff through this. She's been on ACA support for a number of years. It's been a very healthy thing for my staff. We moved them from a bronze plan to a silver plan, and gained dental. So great advantage to add this to our benefit offering, and we very much hope we can maintain it next year.